welcome to our third episode of IgniteMD. Here we are with Dr. Rupak Dhoot, and we're going to be going through his journey as a doctor, go further in as his specialty as a ophthalmologist, and we'll also be giving some inspirational stories and advice. So please stay tuned.
So I'm an ophthalmologist, which is a type of eye doctor that specializes in both the medical and surgical treatment of various eye diseases. And so, that's pretty much it in a nutshell.
What inspired you to become a doctor? There are many inspirations that people follow, and they're always exciting to see. What was yours?
Yeah, so I don't think I realized I wanted to go into medicine until I was towards the end of my high school and maybe in the beginning of college. But what inspired me was my father's a pediatrician, and he derived a lot of satisfaction in his job and really found meaning in his everyday work. And so for me at that age, with little exposure to other fields, that was an easy choice for me.
Yeah. That's having your parents being doctors, it gives you like a pathway, right? And so ophthalmology, it's a very intricate field. I mean, the eye is, I don't know, I find my eye really important. So it's a very complex field too, I've heard. The eye is hasn't always been what humans have thought they are. There are many layers to the eye that are actually really complex when it comes to the field of medicine. So what made you go through ophthalmology, and why did you choose that instead of following your footsteps to be a pediatrician?
Yeah, so in medicine, the biggest challenge as a medical student is getting exposure to various fields. So many medical students will go through their core rotations like pediatrics, family medicine, internal medicine, OB-GYN, general surgery, but there's a lot in medicine. Even specialties have their own subspecialties. And so I was fortunate to be able to shadow an ophthalmologist during my third year clinical rotations in medical school. And really seeing the technology implemented in ophthalmology is what got me involved. First time I saw cataract surgery under the microscope, it was an amazing experience. Seeing the eye in such level of detail and seeing such an impactful surgery being performed so gracefully and in such a slick manner, that's really what hooked me right off the bat.
And speaking about your clinical rotations and education after medical school, how was it like working or shadowing in such big hospitals with such complex technology?
So, medical schools, when you're in the medical student phase, you'll be in a pretty big hospital system, and depending on your prior exposure, some people go into medical school with experience as a nurse, as an EMT, or no experience, just going straight from college to medical school. So depending on what your prior experience is, it can be a pretty big adjustment to understanding the healthcare field, because healthcare today at least is a very complex field, aside from just going to clinic or going to the hospital to take care of patients. There are many roles in healthcare. There are many layers in the logistical side of delivering healthcare, many layers in the actual practical side of delivering healthcare. So, being in medical school and being part of those health systems is just, kind of the first step out of drinking through the fire hydrant that is medicine today. So it's an ongoing process. Healthcare is constantly changing, and the systems in which we practice in are changing. So what I learned then is going to be different in the future.
And so, speaking of that, how do you adapt to new knowledge that comes into medicine?
Yeah, so we always have to be staying on the forefront of our clinical knowledge. So it's kind of like anything, the way we learn things even after medical school. So you get the bulk of your knowledge in medical school and then through your residency training. But of course, as they say, the learning never stops. So It's through a variety of sources. We get education through formal conferences, like, we just attended the American Glaucoma Society meeting not too long ago, and it's always great to see the forefront of medicine. But aside from just formal learning and reading academic journals and attending academic conferences, we learn also just from our peers. So just working with my colleague here, Dr. Ket Paul, who's a retina specialist, I learn more about the retina field every day, every time I see a patient. And working with the other ophthalmologists in the community, I'm always constantly learning from them as well, and just having an open communication with them. And fortunately, we're in the day and age where people like yourself are creating content like this, and so there's various YouTube channels now dedicated to ophthalmology. So those are other avenues in which you can stay on the latest.
Yeah, and speaking on your collaboration with other physicians, your colleagues, many people view doctors as independent job, and we're kind of here to debunk that. You don't really go independent. You work together as a team. Not just, even if you own your own practice or you're working in a hospital, it's always collaboration, not with treatment, but also just being yourselves, being with each other for the journey, right? And the journey never stops. I mean, there's so many doctors who get straight out of med school, they want to work in a hospital, and then they go own a practice. And so, speaking on that, what is your opinion on collaboration? Like, how important is it to you in this field?
Yeah, so I think there's maybe a couple different things that you're trying to get at here. So collaboration is important in any field, especially medicine. So for example, my last patient before you came here today, had a fracture of their eye socket. So I'm not an oculoplastic specialist. Those days are behind me in my residency days, doing fractures and as a resident. But communicating with the oculoplastic doctor, communicating with oral maxillofacial surgery, those are things to do to deliver the best patient care. Now, the system we work in, though, that's going to be different. So, if you're in a big healthcare system, everyone's under one roof. Whereas if you're in a private practice setting, you're kind of having to find the connections to help take best care of your patients in terms of collaboration from that standpoint.
Yeah, and still collaboration is pretty important in just various aspects. And let's go to your experiences during medical school. Do you have any particular experiences that led you to specialize in glaucoma and your current specialty?
Yeah, so I didn't realize I was interested fully into glaucoma until I got into residency, but I did have a good experience in medical school where I did an away rotation in New Orleans with a great glaucoma doctor by the name of Dr. Ramesh Ayala. And his attitude towards glaucoma really was kind of, I guess, the initial seed into going into glaucoma, because he was always pushing his residents and his fellow to stay on the edge and do the best for the patient, and never compromise on just doing the best and being the best. So that was the initial seed. And then when I got to residency, another great mentor of mine was Dr. Feldman in Houston, and he has a very similar attitude as Dr. Ayala, basically not compromising, doing what's best for the patient. So I think not only the interest in glaucoma is a fascinating field in itself, but also my mentors played a big role in their attitudes towards it. And from the medical side of things, glaucoma is a fascinating field. It's constantly evolving. We've had a lot of changes in the last 10 years in the types of surgeries that we do and the types of treatments that we can offer. Unfortunately, though, it's a disease that we haven't conquered yet, so there's a lot to come. And so that's what gets me into it. So
the feeling of unknown, right, and the ability to make it known. And speaking of glaucoma, many people have never heard of glaucoma and don't fully understand it. And how do you explain glaucoma to someone unfamiliar, like say a patient who has been diagnosed with glaucoma? Yeah,
so my bread and butter. So the very brief way I describe it to patients is, I can describe it to you here. So it's a prevalent disease, and it's a degenerative condition of the optic nerve, and that's the cable that connects the eyeball back to the brain. So if you're missing cable fibers, well, then the whole picture doesn't get transmitted to the brain, and that results in missing spots in the vision. So glaucoma is a silent thief of vision, so people don't realize that it's going on most of the time, because it tends to affect the peripheral vision first, and it tends to affect an overlapping visual field. So if I'm missing vision in my right eye, it tends to occur in an area which has an overlapping field with my left eye, and it starts as areas of decreased contrast. So just subtle spots of decreased contrast that our brain really doesn't pick up on. And in fact, just our brain can even make up a story and kind of fill in the blanks, so that way we don't realize it's going on. Now, up until today, really the mainstay of treatment for glaucoma is lowering eye pressure, and that's what I tell my patients. But our hope as a society is to find other risk factors that we can modify for glaucoma other than just eye pressure. Eye pressure is challenging to control as it is, but hopefully we'll find other things to modify the disease course. But that's glaucoma in a nutshell.
Yeah. So it sounds like it'll sneak up on you.
Yeah.
Yeah. And do you familiarize yourself with the latest advancements in glaucoma treatment? Like you were saying, eye pressure, it's a really important modifier to control when treating glaucoma. Are there any other advancements or new knowledge that you could use to?
Yeah, there's always new things coming out that, make us question whether there's more that we can do.
Mm-hmm.
There are new things coming out that better allow us to tackle eye pressure. There are other things coming out that allow us to target those other risk factors. And we'll see. The data is yet to pan out, but, there are studies looking into supplements like niacinamide and citicoline for glaucoma for neuroprotection, because the optic nerve is a nerve, so neuroprotective supplements. There's studies coming out as to how can we better improve fluctuation in eye pressure, such as goggles that adjust your eye pressure at nighttime while you're sleeping. There are new surgeries coming out that better adjust eye pressure. In fact, there are studies out there that talk about meditation and mindfulness and its relationship with eye pressure. So there's all kinds of things, and we're looking at all kinds of risk factors, and blood pressure is associated with worsening of glaucoma as well, whether it's high or low blood pressure. We're still teasing that out.
Yeah, it's a process, right? And one day we'll get the cure. And what is the most challenging, say, encounter that you've had as a doctor? Either in a patient or in like a case where you get stuck. So what did you do, and why was it the most challenging?
Yeah, I think, as a glaucoma specialist, we frequently encounter challenges on a day-to-day basis. We're always thinking of, okay, what is our next step, actually? Because, when it comes to glaucoma, we have, 5 different eye drops, we have 3 different lasers, we have got many different types of surgeries. So that tells you we don't have a silver bullet yet. Mm-hmm. And so, when I start a patient on a drop or I do a laser, I'm already thinking in the back of my mind what the next step is. Now, challenging patients are people who've been through all of the steps. Mm-hmm. They've had drops, they've had lasers, they've had surgeries, and now, despite surgeries, they still, their disease is worsening. And that kind of falls into 2 categories. People who have, pressures that you have a hard time controlling through, various surgeries. And you have patients who still, their glaucoma worsens despite you controlling their pressure perfectly. So those are the challenging patients, and they're uncommon, but in our world, they're common enough that you'll see them on a weekly basis, and they're challenging because sometimes patients are asking for answers, and sometimes you just don't have all the answers. So,
and when you don't have an answer as a doctor, what do you do?
Yeah, so they always talk about the art of medicine. Mm-hmm. So connecting with your patient's important in these aspects. Sometimes when we get into the clinical grind where we're just day in, day out in clinic, there's a certain efficiency in that where you get in that grind, in that machine mode where you just look at everything analytically. But connecting with the patient and helping them beyond what you can do can also make an impact for patients. Mm-hmm. Like connecting them with other resources that perhaps they can seek out, and giving them other avenues to look into to help with their disease. Sometimes just taking a pause, for their difficult condition and commiserating with them. So
yeah, that is that's one of the most say complex things as a doctor. What if you don't have the answer, right? And that will take us to our end of our first half. Doctor's going to take over for me, and we'll start from there.
All right, so back again with the second half, and so I myself have interest in the business field a little bit as well, and I want to do or own my private practice later down the line. So I do DECA at school, and it's something that I have a passion for, and so obviously you own, or co-own some type of practice here. So if you would want to just speak a little bit about it and why you decided to not go into like the bigger healthcare or hospital setting versus what it is right now.
Yeah, it's a difficult decision in medicine as to what type of practice setting you want to be in. The private practice model, though, is on the decline. I don't know the statistics from maybe 20 years ago, but I believe less than 40% of all physicians are in private practice now, or at least practices that they have some ownership, profit sharing type of interest in.
Right.
And the remainder are typically in an employment setting, whether it's through a private equity or through a major healthcare entity or some academic place. So there are pros and cons to any situation. The pro of being in your own practice setting is autonomy. You can govern how your day goes. You can govern what you do for patients. There's no one kind of over your neck telling you, okay, you have 3.25 minutes with each patient, and then you've got to be moving on, or you have to do 10.8 surgeries in this week or something like that to meet your budget or whatever. So I don't know if that's actually the case on the other end, on private equity sides, if someone's actually doing that. But that's, of course, the thing that people will say, oh, when you're in that entity, that's how it goes. So healthcare practices come in all flavors. There are probably some big groups which are very well run, and you get a fair shake on your work life, vacation, how you want to do your day, your compensation. And there are probably others where it's not such a fair shake. So in private practice, you have much more say on how your day goes. Disadvantages, though, are dealing with headaches. So there are headaches. Healthcare is constantly evolving, dealing with changing insurance plans for patients, and running the practice on day to day. Like if something breaks down, that's on you, rather than asking your big employer to take care of for you. Disadvantages of being in private practice versus being in an academic setting. Well, as most physicians, we love teaching and we love collaborating with others, as we discussed previously. So, that's a big part I miss, working with others and working closely with residents and peers, because there's a sense of camaraderie and a lot of interesting things to talk about when you're in that type of setting.
Right. Yeah. I mean, there's obviously pros and cons with, owning a private practice, like you mentioned. It's on you if something goes wrong, and you can't necessarily rely on the bigger healthcare system. So we'll move on to like how and what were some cases that you encountered where access to eye care. I wouldn't say necessarily like the North Texas environment, but like access to eye care was a challenge, and how do you help bridge that gap? I know we're like in the North Texas area where access to healthcare is prevalent, but maybe it's a situation for a lot of people. So maybe, I don't know if you know what the question I'm asking is, but
yeah, I mean, I guess in general, access to care. So particular to our geography, I mean, there will be healthcare disparities in any region.
Right.
Particular to our geography is, something that, I see, and to probably varying degrees than my peers. So in our practice, we do a decent amount of, kind of what we would call volunteer work, where basically patients are unfunded, but they're dealing with an emergency, and so we end up taking care of them through various means. It's a challenge though. Some patients have very complex problems that require very expensive solutions in our current healthcare format, which require surgeries or multiple surgeries. And sometimes they just can't get it because not through any lack of trying, but there are constraints financially from the institutions in which you operate in, and that can limit what you can deliver for a patient. And there are safety net hospitals for patients who have these things. There's county hospitals in Texas that deal with indigent patient populations, but there are many counties where indigent patient population has no safety net and no backup plan. And we end up seeing them on the late side of things when they've had a lack of access to care and their disease process has progressed, and you see them at a stage which is more advanced than would have been the case had they gotten care earlier.
Right. So what would you advise, people for, who obviously have these eye conditions, to better take care of them, either it be, prior to treatment or even after, for maybe our generation, what's the best way that we can take care of our eyes?
Yeah, I mean, so eye screening is important. And that happens at various levels. Mm-hmm. So, when we're developing age 0 to 6, the pediatrician is typically the first line for screening, where they're looking at whether the eyes are developing normally, whether the eyes are aligned, or whether, mom or parent notices any developmental abnormality. Past that, and where you guys are in your age range, towards the end of, adolescence, your eyes mostly developing, and, during this time, any problems passing, vision tests in school, those need to be looked at, whether you need corrective vision from glasses that can be solved with, a visit to the optometrist. Past that age, eye problems up until the age of 40 relatively are uncommon. They can definitely happen, and the prevalence may increase as various problems in our society increase, like myopia is becoming an epidemic where people are becoming more and more nearsighted, perhaps due to our time spent indoors and more time spent on screens and things like that. That will be something that shifts in the next 50 years for us. Kind of going in a roundabout way, but to answer your question, it varies basically. So screening is a big thing. So, we generally recommend screening past the age of 40, but getting a regular eye exam is important to prevent to catch any problems. So.
Yeah, so you mentioned myopia, becoming a new, new trend, I guess, in society today. So we also talked a little bit about technology and how that's, new and incoming and, on the forefront of the medical world. So I actually recently saw like a study about, these specific types of glasses. I don't know what specific brand they were, but do you know any like types of new technology like that, wearable devices that may help with these specific eye conditions?
So I'm hopeful that there will be wearable devices that help people with low vision significantly. There are already low vision aids for people. As we were speaking, there are some conditions which result in permanent severe vision loss, and low vision aids for those patients will be incredible for them to be able to be more functional in their everyday life. I'm sure they're on the way, and I'm sure we can develop the technology for it if there's if it's not already being done. There's other technologies out there that but that's the one I'm looking most forward to. So
it's cool, yeah. So we'll harken back to like I feel like medical school stage of your career. So what advice would you give to people like us, high schoolers, who want to pursue the medical field?
The road is long,
yeah.
And it's going to be a different climate of practice than by the time you finish. So doctors practicing 20 years ago, it's a completely different environment than it was 20 years ago. So just best advice is go in there, be passionate about your interest, and whatever specialty you decide to do, just know there's time to decide. Get as much exposure as possible. So find every opportunity. You guys are doing a great job interviewing various doctors to get an idea of how the field works, and that'll give you the best idea. Because going back to my experience, fortunately my father was a pediatrician, and I got a lot of good experience in medicine from him, and was able to see how fulfilling of a career it was. But at that age, it's really tough to find what you like. Your exposure is limited, and you're really at the mercy of just bias to your exposure.
Mm-hmm.
So.
Right. So, how did you specifically prepare for, like the medical school stage, about the whole application process, as well as how did you prepare for specific healthcare, whichever healthcare major you did, that led up to, admission into medical school and later residency as well?
Yeah, so this is constantly changing.
Right.
When I was in college, undergraduate, the, typically you would be fine if you scored well, maintained your GPA,
Mm-hmm.
and if you did well and you had a true compassion for going into the field, you would make it to med school, and you would make it to the specialty in the field that you desire.
Right.
Those are changing. There are going to be different things that schools are looking at today, and I haven't kept up with the things that they look at, but I would say keeping good grades, doing other activities that give you exposure, are the best way for you guys to prepare for a career in medicine, and prepare for you guys to present yourselves as interested applicants who would be attractive candidates to medical schools.
I see. Yeah. So if you could go back and give your younger doctor self, I guess, any advice, what would it be?
That's tough. Yeah, I think I don't know. Yeah, I'm sure there's a lot of advice I could give.
Yeah.
I mean, I guess I wasn't a perfect student, but we always wish we could go back in time and do some things better or certain things better. But I guess I'm at a loss of words, because really my attitude throughout training was to just do my best and really take as little stress as possible about outcomes outside of my control. Mm-hmm. And I think that's probably the advice I would reiterate to my older self is just don't worry about things outside your control. Do your best, and that's all there is to it. So.
Yeah, and I think that in today's age, especially kids of our age, they're very competitive, very outspoken in the sense that they are overachievers, and so we find ourselves constantly trying to do different things, trying to figure out where we want to go. But your advice on just if something's out of your control, don't bother, right? Don't waste your time and energy trying to worry about it. And I think for both of us who want to pursue the field of
With that being said, I mean, you'd be surprised by how much you can accomplish. If you just put in earnest effort. If it seems out of your control, I mean, maybe there's a chance it isn't, right? But I guess the key is not to stress about it.
Right.
So, I think if I asked my college self would I be doing all these cool things I do today, it would be just unimaginable to me.
Right.
But it's just you just keep at it, and if you do your best, whatever your goal is, it'll become realized through some shape or form.
Yeah, perfect. All right, well, that'll be it for episode 3. Thank you so much for
of course.
meeting with us.
Yeah,
and,
thank you guys for this talk.